That's really one of the most important things to me, because I want to come to work with a smile on my face and feel like I'm doing something important. And as you know, back in the day, I was a sculptor and artist, and this is a next level kind of thing. And having the knowledge I have of fine arts, philosophy, and medicine, I know what's done, what the standard is out there, and I take immense gratification in doing something a little different. So if we take the most superficial level, what we're doing, essentially we're doing a facelift. Lots of people do facelifts. However, if, like most things in life, if you apply one thing to all situations, you're really not doing it right in any situation. So I pride myself on really having refined, meticulously designed subsets of each procedure where I can pick, select, and adjust for each patient. So there's several different kind of flavors or kinds of facelifts that I do, depending on so many features of the patient's interest, who they are, what their financial point is, what they can afford as far as downtime, and what they're comfortable with. Because there's so much stuff that scares people about plastic surgery today out there. So even if a patient really trusts me, it's not every day that like, just go for it, do all the right things. This evolution of this patient is not so uncommon. She found me, she caught onto what the driving forces are in the practice, my practice philosophy, which kind of resonated with her, which are probably the natural looking focus, which is very unique in my opinion. The meticulously designed procedures that are not out of a book, that are not cookbook, that are not mainstream. And so originally, I think she was attracted to my microlift technique, which actually incorporates deep tissue work with minimal recovery, minimal dissection, and a quick procedure that does not affect the face. Everyone's really afraid these days of having a windswept look. So people are really a lot more willing to accept the clavicle to lower third of the face. I want this better and just don't mess with my face. So that's very common. So that's probably what brought her in. But understanding what I do and how every component of what I do is designed opened up her mind to thinking about, my mid-face is descending and I'd love it to look like it looked 10, 20 years ago. However, I don't want to risk these people that are doing these wacky things that look so weird.
That look like cat ladies. I didn't want to look like a cat lady. And listening to him and watching his social media, I saw and heard how natural he is and how he cares about, really, you wake up and you have that natural, youthful look over and over again. That's what he talks about, the natural, youthful look. And that is what attracted me to him. Those words just resonated with me over and over, because I flew in from New York for this. There's plenty of plastic surgeons in New York, but I just, after listening to him and talking to him, I knew that I was going to be happy coming here and getting this procedure with him.
So there's kind of two major parts of success in plastic surgery. One is technique and one is execution. So first of all, you need to understand techniques and be technically refined. From my perspective, actually fully trained in plastic surgery, then I did the most elite craniofacial fellowships in the world, which is way overkill for what we're doing today. But I have a profound understanding of facial anatomy, what works, what doesn't work from even a skeletal perspective. So I trained with Ortiz Monasterio, the really father of craniofacial aesthetics, and I can move your facial skeleton eyes around to make you look better. So early in my practice, when I started my practice, I thought, well, I'm a master of moving the skeleton around. Well, we have hyaluronic acid fillers, we have all these things. I can do it with soft tissue without this crazy recovery. And so originally, that's kind of the orientation in my practice. When I first started my practice, I trademarked the term histiocentricity, which means tissue focused. And that's exactly what I do. What is the minimal insult for maximal effect? So it's cleverly designed that way. And so because I've mastered all these techniques, I've done every kind of facelift technique out there before I even started my practice, and I'm very comfortable working the deep plane like we're doing today, right next to the facial nerve. The most dreaded and common complication for facelift is hurting a facial nerve, causing a palsy or a droop. So that's the technical aspect, understanding the technique that's appropriate for the patient to give the maximal result with minimal recovery. And then the judgment or refinement portion is dosing it. How tight? What direction do I pull? All that stuff. those two things go into it. But the short answer to your question on recovery is, instead of taking apart the entire face like I did when I first started, I trained with the Masters of Extended SMAS technique, which is more common, where you take apart the whole face in the superficial layer, you take apart the whole face back here as well, so you have several delaminated portions of the face, all contribute to swelling. You look like a balloon. You can get good results like that. I don't think the results are as effective for many reasons beyond the scope of this conversation, including you're pulling from far away to your target, ligaments we're directly addressing, all these things. But with a deep, plain composite face, that's the way I execute it. The dissection is actually less than a lesser facelift. I dissect a very small subcutaneous under the skin space that I cut through the strong layer of the face called the SMAS. Paper thin, strong layer, and once you cut through it, underneath is what doctors call a loose areolar plane or a potential space, meaning if I put a straw there and I blew, it would fill up with air and almost completely open up except for the structures, the ligaments and nerves. So when I go in there, I open it, and that dissection really isn't dissection because it's already a space. So meticulously take down the ligaments, release them, and then that glide plane or space moves. So really, to take apart then move around the whole face, I'm just dissecting this little tiny bit, which minimizes recovery. I combine that with a microlift technique, and the microlift technique really was designed by me with my experience to give maximal effects with minimal results in patients that would never tolerate a facelift. So the microlift is, I'm not getting a facelift, but I want this looking better. So it's a minimal dissection where I have this, what I call a check kite suspension. About a decade and a half ago, I came up with the conception of a Maercks lift, my last name, muscular aponeurotic elevation and retention check kite suspension, M-A-E-R-C-K-S. So that is the concept that's over a decade old that I put into everything. So that concept goes into the microlift, where I suspend the platysma of this muscle, but really where it needs to be suspended, instead of taking it apart, cutting it, slicing, dicing it, which is what pretty much everyone else does, which causes profound recovery, additional risk to the facial nerve, and additional risk to hematomas and complications. So because of this technique, this is the technique I use that patients sometimes go to dinner the same night of surgery, like zero recovery. When I go into the face, I never promise people that, but a lot of my patients in 2 days look like they're ready to go, makeup ready with hair down, out to dinner. Can't promise that.
That's what I'm hoping for.
No problem. I tell everyone 2 weeks, but it's really the meticulous design of the procedure, the technical understanding, expertise, and then like the dosage or execution of it in an artistic way. So I could not imagine being the plastic surgeon I am right now if I was a standard track biochem med school focused on science. And of course I did all the sciences, was focused, and I fell in love with physics when I was in high school. So I've always had a scientific background, but my focus, like not having an end goal originally of being a plastic surgery, having an end goal of being the best artist, breaking ground in the media, doing new things, getting my hands in it, what happens if I don't use my, exploring all these things in high school and college made my brain develop that way. And I ended up dropping out of art school and thought, what would I do? And at the end of the day, I'm a philosopher. So I spent my undergraduate years refining my fine arts, creativity, and analytical philosophical thinking. The focus of my philosophical studies were really all about ethics and aesthetics, strangely enough. Now, I wish I could say I'm brilliant enough and forward-thinking enough to have planned this, but it's a kind of a perfect kind of evolution that a artist philosopher interested in understanding ethics, mostly virtue-based ethics, neo-Aristotelianism, and how aesthetics and ethics are related philosophically. That's kind of what I do today.